Bismillahirrahmanirrahim. I am Dr. Mohibullah Wazir, and we were discussing the mediastinal surface, and I told you present on the mediastinal surface is the hilum of the lung, and the hilum is the point where the structures leave or enter into the lung tissue, and this is being enclosed. You can see in this parietal peritoneum sleeve, which is called as pulmonary ligament, is enclosed in it. And now, what are the structure that enters? Number one, the bronchi, and number two, the pulmonary arteries and pulmonary veins leave it. The pulmonary arteries enter into it, and then there are the bronchial arteries, and then there are the nerves, autonomic nerves, and then there are the lymph nodes present over here, which are being called as hilar lymph nodes. These structures are present in the hilum of both right and left, but with a little bit difference in the arrangement of the structures. Okay, and now you look on the left side, the hilum. On the left side, the hilum. Look, the uppermost part, make it close. The uppermost part of the hilum is being occupied by this pulmonary artery. You look it over here. The uppermost part is being occupied by the pulmonary artery, and posterior to that you can see the left principal bronchus. So you can see the uppermost or superiormost part occupied by the pulmonary artery, and then you can see this pulmonary bronchus, that's right left principal bronchus, and then you can see these pulmonary veins, look above. So in the same way you see the uppermost by the pulmonary artery, then bronchus, and then these red pulmonary veins which take oxygenated blood from the lung to the heart, and then you can see these small hilar lymph nodes. Okay, so very clearly look, see the pulmonary artery, and you see the left principal bronchus, and these are the pulmonary veins. This is the arrangement in the left hilum. While look in the right hilum, what happens? That note the important point. In the right hilum, the right principal bronchus, before entering into the lung, it divides into two, and this is the upper lobe bronchus, this is the middle lobe bronchus or intermediate, while the left principal bronchus enters into the lung and divides inside the lung, while on the right side, the right principal bronchus first divides into this upper lobe bronchus, this is lower lobe bronchus. Look, this one, look, this upper lobe and lower lobe bronchus, and then below these bronchi, look, and then superior to that, look over here, then there are the arteries. This is, look, this is the bronchi, and then you can see then the arteries and the veins, the pulmonary veins. But to the point is that the right principal bronchus divides first into two to enter into the hilum. So the right hilum is having two bronchi entering into it. In the same way, the artery may also divide into upper lobe branch before it enters into the hilum of the lung. So this is the difference between the two right and left hilar structures. Now you look over here again. Look, this is the right lung, and you look, this is the oblique fissure which divides the lung into upper and lower lobe, and then you can see this small transverse fissure. In this way, the right lung is having two fissures and having three lobes: upper lobe, middle lobe, and inferior lobe. And you can see the lobes are very clear cut separated from one another, and you can see this visceral pleura, and you can do the lobectomy very easily, and the function of other lobes will not be disturbed. While on the left side, you can see the left lung is having only one fissure and having two lobes, the upper lobe and lower lobe. Of course, some people consider as the lingula, as the lingular lobe or the third lobe as well. So the left lung consists of one fissure and two lobes, and the right lung consists of two fissures and three lobes. Okay, thank you very much.